can see like how much slim you are.
Compared to that, yeah, no,
like-
my jaw has completely like come in. Like I have cheekbones. now.
You can even see the shadow here, like there's no fat.
Oh yeah, no, when they did the chin lipo last time, they really sucked the fat out of my lower face. I don't even remember looking like that, I swear, when I see myself before. When I look at those old videos of pictures on my dome.
Do you recognize yourself?
No.
No. Your eye shape changed too. I mean,
The brow, it opened my eyes up. The brow bone completely opened my eyes up. If you see in the middle, in the before picture, it closes in right here. And then
you look more like angry.
Bye guys. The main area is this side of my face. I feel like this side of my face has a heavier right here, or it like drops more on this side specifically than this side. I feel like then you can see the difference like in the jowl wall. If you pull this back, my chin doesn't even look as bad. I mean, my chin is still over projected and a little bit wide, but it's not as bad as when you let it. Is it gonna go down, under, and around? Are we doing like neck and face? Like what are we doing?
There's this procedure called the half facelift. It's shorter than the full facelift. The starting point of the incision will be from the crease of your ear from the top, and then it will follow the natural crease and behind the ear up to like this point. Not too long, extended.
Where do you want to focus the fat grafting? I originally was thinking like up here and then like the slightest bit like in this area, but what are you recommending?
근데 꺼진 데를 매끈하게 해서 라인을 만드는 건데 위에서부터 보면은 지금 이마가 이렇게 좀 평평하기 때문에 볼륨 여기 세우는 식으로 가면 좋고 이어지게 지금 광대랑 이마에 이어지는 이 관자 쪽이 좀 꺼져 있어서 여기 라인 맞추는 정도로 이렇게 채워주면 좋을 것 같아요.
I've seen some people get the fat grafts and they have like overfilled the forehead or the temples and it looks a little bit, because we did the brow bone to take away. So as long as it like we can keep the
So what Dr. Kwon is gonna do, this is her technique. She does fill out a lot at first. It will look awkward. However, she knows how to calculate how much it will be.
like 30 to 50%.
So it doesn't look awkward, okay?
그리고 이제 더 옆에서 보면은 앞볼도 되게 평평해서 입체감이 떨어져서 앞볼도 같이 이렇게 볼륨 채워주면 더 좋을 것 같고, 그리고 팔자는 심하진 않지만 같이 약간 채워주면 더 좋을 것 같아요.
I feel really good. I am a lot less nervous than I was yesterday. I think just between all the traveling and stuff like that, I didn't have time to like relax and give myself a second. But like last night I got a lot of sleep and this morning I woke up really refreshed and I feel great. I'm kind of ready for surgery. I just want to get it over with now. I think today's gonna go really smoothly. Just like last time. Last time was very smooth. I have a lot of faith in Nana and their results and their doctors. I trust them fully. After leaving the consultation, I tried to eat a little bit just to get some stuff in my stomach, and then immediately I just slept. I just slept a lot and I tried to hydrate as much as possible. I drank a lot of orange juice, a lot of water. What I was going for, like a little bit of a shorter chin, a slightly like a little bit more pushed in and a little bit set back.
This is the side profile of your face, and your chin is actually protruding and forward.
Yes.
So the golden ratio from the side profile is the projection of the tip of the nose, the lips, and the chin. One straight line. But based on the ratio, your chin is actually like 3 millimeters forward. Can you see the triangle that he is drawing?
Yeah.
In between those two lines, that's how much he's going to remove. And then as like a sandwich, like layer, he will reduce 3 millimeters.
이때 같은 경우는 앞으로 2mm 정도 좀 수준을 해서 이제 저고 이제 고정을 좀 해놓을 거고.
We will try our best to shave this part and the outer part here.
This outer part right here?
Yes, but this is more on the square jaw surgery.
Yeah.
Think of it like this much will be reduced 3 millimeters. Can you see the sticking out? This will be 2 millimeters back.
I feel like it's like the only nervousness is really just like going into the surgery room. I feel like that's like the only thing I get scared of. Or it's not even like scared, it's just like the anxiety of like, oh my god, you have to lay on the table and then they have to do all the stuff and you're sitting there for like 10 minutes before they knock you out. That's kind of it. I feel like I would
Usually just knock you out first.
yeah, like knock me out up here and then whale me down there. I don't even want to know it happened. As soon as you knock out, it feels like you're asleep for 2 minutes. Remember last time, she was like, Maia, surgery's done, wake up. And I was just like, what are you talking about? Like, I'm sleeping. Yeah, I'm asleep. Forgot I was even having surgery.
And no pain when you woke up?
No, the last surgery I was completely fine. I think I looked over at her, turned my head and smiled and was like, hey, what's up? She's from Docfinder.
I'm from Docfinderkorea. I'm excited to meet you when you come.
That's how far back the facelift goes.
gonna be snatched.
Snatch that jaw back up, bro. They're putting the chin back. They said because it goes too far. They're pushing it up, and then they're gonna shave right here, like this part of my jaw a little bit.
So you're getting like a mini V-line.
Like a mini V-line without touching like this, almost. Kind of. He says he's gonna try to shave this as much as possible, like right here.
What's with your forehead?
The fat graft. They're fat grafting my forehead, my temples,
Okay.
PRP, and Botox.
Good luck.
you.
Congratulations.
Thank you,
I
bro.
can't wait to see you when you get out.
I know, I'm gonna call you when I get out. I'm going into surgery right now. I will see everybody soon once I get out of surgery. A little nervous, but I'm okay. I'm okay. I think I'll be good. I have faith.
I'll see you after.
I'll see you right after.
This is just a roll into the hotel. It's not that bad. My jaw hurts a little bit. To be transparent, more the throat than anything else. Like the tube in my throat. Good morning. So, as you can see, my forehead is super swollen, kind of giving mega mind. And so are my cheeks. I would say the pain level is like a 2 right now. Mainly just because of the chin strap pushing in on the chin. Like, this is very tight. I'm okay. Today is post-op. I know I'm getting the dressings, the oxygen chamber, and everything done today.
After my first surgery, I feel like my chin became more prominent in my lower face, and I think my biggest issues in the beginning were just my nose and my brow bone because they were so overly projected. Coming back, it was just to soften up and like tie up the loose ends of what I noticed after my face had fully healed the first time. I didn't really want to overdo anything last time too, so I didn't add like the fat grafting in because we had talked about it, and we had also slightly talked about a genioplasty last time. So everything that we just like didn't do, we came back and did this time. When I look at my jawline and neck, I'm seeing, even though it's very swollen in this area, I'm still seeing it's like very pulled up more. I feel like I can see on this side of my face, one, the definition from the fat graft, even though it's swollen, and the tightness when they pulled it back a little bit because there's like a lot less jowling or heaviness around my chin. I think within like the next 2 weeks, I'll see a lot more, especially with the fat grafts, and I'll be very happy. So I really like the results from my first round. That's why I came back for my second one with Nana. I came last August. I was here for like almost 2 weeks. I had my brow bone reduction, a brow lift, facial liposuction, and a rhinoplasty. My recovery was really easy. Honestly, I feel like the worst part was having my eyes swollen shut for like a day and then having the tampons up my nose for a little bit. But other than that, it was really easy. It looks worse than it is. I was a little nervous because I had never had like facial surgery before. Yeah, let's go. I want to eat. I want to sleep. Everything's gonna go great. We're gonna be good. I think by like the 3rd month, I looked a lot more normal and you could see all the results very clearly, and I was super happy with them. Everybody that knew I went to Korea was a little worried about me going out of the country because some of them have never even left the country themselves, but they were all like very pleased, and a lot of them are now even considering coming themselves. My overall experience in Korea is amazing. I think everything in Korea is a little bit better than America at the moment. It's very clean here. The doctors and everything I felt like super taken care of. I felt like they were a lot more thorough with testing and then just making sure they knew what I wanted specifically. Docfinderkorea was very helpful, and just I've always had like a very great experience in Korea. Yeah, I would definitely come back to Korea, and I've very heavily advocated to all my friends that are trans that like my surgery results to come to Korea themselves, like including one of my friends, Moxie. She's coming in January. A lot of the girls that I know that have gotten surgery, whether it was in a Beverly Hills doctor or a different doctor that nobody knew about in America, I felt like they weren't as experienced in like cranial facial surgery. A lot of people I would know would come out with like over pulled brows. Just they would tell them that they needed things done that they didn't need to. The doctors here were very thorough on like what they think I needed done or what they thought was like actually necessary or would change things. They were very straightforward with like what the result would be and what they couldn't change. Versus in the US, they're just trying to throw a bunch of things on you. Specifically my surgery experience when getting into the surgery room and like the testing the day before and everything. In America, they do the test like a month before, and then when I got it was like a pretty much like a rush type of thing. Almost felt like I was in like go with a room full of people that were getting surgery the same day I was. No other clinic in America has told me my blood type or even cared to know my blood type. That was like one of the first things they did in Korea, and they made sure I knew all of my results the same day. In the surgery room in America, I was only ever in a surgery room with like an anesthesiologist, and to be honest, they were kind of like scattered with everything already laid out, and it was kind of like a little bit more spooky. I feel like when I got into the surgery room here, there was obviously the person next to me, Alina, who was helping me and translating if there was anything that wasn't need to be translated, and there was like several nurses and the anesthesiologist there. They were explaining everything thoroughly, and I just felt like each person had their own job and everything was more attended to, so it wasn't like you were just depending on that one anesthesiologist to take care of you while you were waiting for the surgeon through the surgery. It was like very thoroughly taken care of. I'm very happy with my surgery in Korea. I'm waiting to see my results. The next 6 months, I think everything will settle in really nice. I'm super excited to see them. I'm very confident that everything I wanted was done and that everything was super successful. Bye!